Punchki Day to you.
Happy Fat Tuesday, Michael Patrick. Everything in moderation. That's my rule.
Yeah, that's your rule, and that's what Dan Lepp always says, too. Just moderation. And in the meantime, this is Patient Safety Week, too, huh?
It is, and you were mentioning ahealthiermichigan.org, and in addition to great recipes and healthier eating tips, we've got a lot of info on that blog now about how to become a smarter healthcare consumer. And people should check it out. Everything from the fact that you can save a lot of money by going to urgent care rather than the emergency room for non-critical issues, to the types of decisions that everyday people make in their homes around access to health care that really affect their out-of-pocket costs. And there's a lot of really good content on A Healthier Michigan. It's Patient Safety Week this week, Michael Patrick, in addition to the start of Lent, and we're encouraging people to do what they can to become better informed healthcare consumers during Patient Safety Week.
How can they do that other than going to ahealthiermichigan.org, which I find has lots of really cool stories, and it's very well written and very lively, topical too.
Yeah, Blue Cross is trying its best to put out a lot of content written in a real clear and simple way for people. Healthcare is really confusing, but one of the best places that people to turn is really the tried and true relationship that a lot of people have with their family doctor. And Blue Cross has tried over the past few years to rebuild those relationships through our patient-centered medical home program. It's the largest in the country, and we're rebuilding the relationship between primary care doctors and patients, and we're having such success that, in fact, we're realizing significant cost savings, $155 million in cost savings attributable to the growth of the medical home here in Michigan. And again, Michigan has the largest among the states in the nation, and it's really realizing significant value for patients.
One of the things that people might not know about, and I've learned about it recently, is that you have to be careful which drugs you take with other drugs. And, you might not think about that when you're going through your pills in the morning, what you're taking, what time you're taking them, and so forth. And you have some safeguards that will help people avoid taking the wrong medications at the same time.
We're trying our best to protect our members, Michael Patrick, from dangerous drug interactions. And at Blue Cross, we cover 4.4 million people here in the state of Michigan. We've got a computer program that runs all of our patients' pharmacy claims on a regular basis, and it cross-references them for drug and disease interactions. And some people are taking 10 to 15 different meds. And so what we want to make sure is that those drugs don't interact with each other in a harmful or dangerous way. And since we initiated this program, more than 2 million safety alerts have been issued, helping people avoid those dangerous drug interactions. And it's really something that's improving health care. It's really preventing conditions from worsening, and it's in fact saving lives, and it's something we're really proud of.
Well, if anyone should think that when you have a Blue Cross card that it's a company that you only turn to when you're sick, it's a completely different business model that you're operating on. It is a very active partnership, isn't it?
It is. The role of the health insurance company, and we embrace this, is to keep people healthy, not just pay for them when they get sick. So we provide a lot of resources, and we're giving our members a lot of support to keep them as healthy as possible. Everything from the medical home to the patient drug interaction registry that we have, to the content on ahealthiermichigan.org. These are the things that Blue Cross is doing to help keep people healthy.
Might you suggest a third of a punchki instead of the full punchki today?
I have a strong Polish heritage, Michael Patrick, so I think I'll be indulging. But again, everything in moderation.